Hello, I'm Dr. Hwang. This time is a part 4 presentation about the tongue group Y extension graft using a concha cartilage. This is a very useful and a very strong method for the tip projection. In severe case, I like to use this operation method. This is a male patient. He wants very high nasal tip and the dorsum, but his lorotal cartilage is not good. So in this case, the tip projection is very limited to the under the 5 millimeters. So, but he wants more than 5 millimeters tip projection. So I use this operation method. Dermocartilage ligament cutting is a very important procedure for the tip projection, as I told you. So this is a operation procedure. I'm cutting dermocartilage ligament, and after the resection of the dermocartilage ligament, and full exposure of the lorotal cartilage, and this is the operation pictures. So after the full releasing, and sometimes I use undermining the lorotal cartilage and the mucosa for the more tip projection. This picture is undermining lorotal cartilage and the mucosa space. And undermining lorotal cartilage and the mucosa is very important for the more tip projection. This pocket is for the placing a concha cartilage Y extension graft. Later I'm going to show how to use it. This picture is a full exposure of the lorotal cartilage, and this is the concha cartilage. Average size of the concha cartilage is 1 centimeter and 3 centimeter size. And by having the concha cartilage and fold the concha cartilage and suturing at the center of the concha cartilage, so it makes them more strong. And this is placing this concha cartilage at the caudal margin of the septum, and this is here is the Y extension. So this picture is a fixation of the concha cartilage and to the caudal end of the septum. After the fixation, the end of the Y concha cartilage, one end is placed to the one lorotal cartilage, and this is a fixation of the concha cartilage and lorotal cartilage. This is after the placing a concha cartilage graft at as I told you previously, the space between the lorotal cartilage and the nasal mucosa. So the placing the end of the Y concha cartilage. And this is the picture of the basal view. And after the fixation, you can make a tip projection using just suturing of the concha cartilage. This is the end of the operation. And another case, I'm doing a Y extension graft. So just like this, you can make more than 10 millimeters projection. And this is the post-op pictures. This is the pre-op and post-op. You can make more than almost 10 millimeters tip projection. This is another case. We can use this Y extension graft in case of very severe contracted nose, just like this. And this is post-op 2 months and post-op 8 months. This is another case for the very severely contracted nose. This is the post-op 6 months. And another case, just a very severely contracted nose. It needs a very strong tip projection and caudal rotation. So most of operation using only the costal cartilage or septal cartilage, septal extension graft, but or the graduated costal cartilage graft. I can correct the very severely contracted nose, not using costal cartilage and septal cartilage, and only using ear cartilage by the folding and the Y extension graft. This is the post-op 5 months. So the disadvantage of the tongue group Y extension graft is a technical difficulty, and there is sometimes in case of early recovery period, there is a rhinorrhea. Some patients are very severe rhinorrhea, but it is end at 2 or 3 weeks. It has gone. So talk to the patient. Don't worry about that. And most tip is the a little bit disadvantage, but it has a more stronger just projection, so you can make more nasal tip projection, and you can use a very severely contracted nose. So it is a very useful and powerful method for the tip projection. Thank you. I hope to see you in another presentation. Bye bye.